Well, Paul, in wrapping up, if I am a CEO of a health system and my health system's in trouble and I'm just learning about organizational well-being and I don't know where to start, do you have any recommendations for me?
Well, you could read my book. It
There
actually,
you go.
well,
I
no,
will
and
post this too.
I say that because what we did with the book, we interviewed 60 different people that were experts in healthcare or burnout or lean as a management system and culture, and pulled all that together. The first 2/3 of the book actually just talk about what's underlying burnout, what's causing it, because the more people understand the underlying factors, the more they'll be able to apply that to their particular situation. Every organization has burnout, but every organization is different in its structure, in its mix of patients and demographics, in its business approach. So the principles, the underlying issues are common, but how they get applied are going to have to be unique in every organization. And this really gives you the tools to understand that and do that well. So that's really key. I think the other thing is to recognize that indeed, in healthcare particularly, probably more so than most other industries, the people who are doing the work that really matters the most are the people on the front lines. The most important person in the healthcare system is the patient. Without a patient, we have no reason to have our jobs or no reason for the hospital or clinic to exist. The most important thing happening to that person is the interaction that happens, the healing interaction that happens between the frontline worker and the patient. Every time we interact with a patient, whether it's a doctor, a nurse, a receptionist, a transport person, the EVS person cleaning a room if the patient's there, it's an opportunity to have a healing interaction, to reduce some anxiety or worry, relieve some pain or suffering, do some definitive treatment, or educate people to be healthier. Mm-hmm. That's the most important thing happening in our healthcare organizations. Now, as a family doctor for 25 years, I probably had close to 100,000 of those healing interactions. But as I moved up the chain, became the CEO, I was no longer seeing patients. I wasn't doing the most important thing to the most important person in our organization. My job became making sure those people on the front lines had what they needed so they could do that well. And all of the support staff, HR, IT, finance, you name it, that's their job as well, is to make sure the people on the front lines have what they need to do that well. When we can come at leadership with that mindset and that becomes paramount, then we truly succeed, because we help these amazing knowledge workers to be empowered in order to function well in the moment, but also create processes which create that alignment so that we're all working together.